Welcome to the latest Voluntary Health Scotland podcast episode, where we talk to Dr Peter Cairns, a GP in Westerhailes, Edinburgh. Peter speaks about why link workers are such an integral part of primary care. Can you tell us your name and your role and a little bit about where you work?
My name is Peter Cairns. I'm a GP here in Westerhailes, where I've worked for many years. We're on the outskirts of Edinburgh. Our practice is about 8,000 patients. Edinburgh's a prosperous city, but Westerhailes would have some quite significant issues of deprivation and poverty. Life expectancy for some of my patients is mid-60s, and there's quite a complex mix of health and social issues that would drive that. That's difficult for a clinician to unpick by themselves.
And in your own words, for those who maybe don't know what a link worker is, could you explain the role of a link worker?
Link workers have been transformational for our patients, and let me just explain that and expand it. I think clinicians have a good understanding that the illness that we see comes from the community around us, and that there are social factors there that need to be addressed in order for our interventions to be impactful. But we're not the experts in unpicking some of that, and the patients aren't necessarily expecting us to do that. So a link worker is worth their weight in gold, because they can work with a patient to link them to that thing that needs to happen, whether that's getting the housing issues addressed or whether it's joining a walking group. And because the link worker is involved, that is much more likely to happen. And that's the key thing here. Now, not every patient needs a link worker. Most of my patients are very resourceful and resilient and can sort that out for themselves. But when people are having a really tough time, lacking capacity is the jargon for that, a link worker really helps make sense of that.
How has the community link worker role benefited the patients in your practice?
It would be difficult to imagine going back to the days before we had a link worker. Our patients really value being able to sit down with a link worker or speak to them on the phone, and to get that understanding of what the issues are that they face. And then the link worker is really skilled at translating that into a real world intervention. Okay, I get that you're struggling with isolation or you're struggling with complex financial things, and these are the local services that we can work with to try and improve these things for you. The fact that they're local, that's key. Because some of our patients, and again, not all, but some, will struggle to use services out with this local community. And the fact that the link worker is based here is really, really helpful for the patients, and helps establish that trust and helps build those relationships.
Okay, that's great. And how has the link worker role benefited you and the other GPs in the practice?
So again, I don't think the GPs would want to go back to the days that we didn't have a link worker. It is part of a wider piece of work. So we're here in this wonderful Healthy Living Centre, where we're co-located with third sector partners and social care partners. It's about making the whole network easy to navigate for patients, but there will always be that very vulnerable 5 or 10% of our population who are going to need a link worker to help bridge them into those local services. That may be because there's a background of learning disabilities, or a background of addiction problems or trauma. Whatever it is, the link worker is really well placed to do that. Something that people overlook, the link worker helps link all those services together, and it helps bring the practice into that network, which is really important. And I think that's sometimes overlooked.
That's great. And if you had one message to the Scottish Government in relation to link workers, what would it be?
Am I only allowed one message?
Yeah, as many as you like.
I think there's a few things we could usefully say. I think the first thing is link working is really skilled and it's really valuable work. It's difficult sometimes to build the evidence around that, but the clinicians really appreciate it. I'm not sure if this is a valid concern or not, but I'm always keen. It's not a question of social prescription, link working, or clinical intervention, because I think these things play off each other, and that's what makes them so impactful. We have been trying to improve outcomes for some of the most vulnerable members of our communities in Scotland for decades, without great success, and link working is a real bright ray of light in making sense of that. So I hope our Scottish Government colleagues are proud of that and excited about it and want to support it.
It's brilliant. What do you value about the Link Worker Network, the Scottish Community Link Worker Network?
I think the first thing I want to say is thank you for all the help and support that we've had so far. I think it's important to reflect that link working is so important, but is not the end of the journey. We should probably be seeing this as part of a wider piece of work that makes primary care and the health service more orientated to these communities, that intervenes more impactfully around all those drivers of the poor outcomes. That's probably what we're looking at. And I think link workers and I think the third sector partners that are usually supporting our link workers have a really key role in shaping that work. So I hope that they can be brought into that. And I think the Scottish Community Link Worker Network does a very, very good job of that.
In terms of the Scottish Community Link Worker Network, what would you like to see the network do next to support link workers across Scotland?
So I think following on from some of our earlier conversation, it is gathering that data and intelligence to better inform what comes next. No, so not just what does good look like, but what does really good look like. I'm a clinician and I don't want to stop being a clinician, but I also understand that there is a limit beyond which the medical model it just gets in the way. It no longer helps. It starts to hinder. And I think we are on the right path with link working, with the Scottish Community Link Worker Network, that wider piece of work. And I would really love to see how that would take shape.
Okay, that's great. Is there anything else you would like to say about link workers or the Scottish Community Link Worker Network in general?
Just that I don't think it's any great secret that primary care has been a difficult place in recent years. The NHS has been a difficult place, and this is one of the really positive interventions that have happened. And we enjoy working with our link workers, and we enjoy the breadth of work that brings into us, and it really is effective and helpful for our patients.
Thanks for listening. For more information on Voluntary Health Scotland, please visit our website, vhsscotland.org.uk.